I just turned 58. Is there a non-surgical way to lighten up saggy jowls? How do I find a qualified doctor or whoever I need to see? Thank you, Rachel.
Thank you for your question. You've just turned 58 and you want to address your jowls. And of course, you want a non-surgical option. So this is a discussion that I have in my practice every day. And unfortunately, there is a lot of misinformation out there that is promoted by people who market various devices on doing procedures that typically require surgery without surgery. But before we go into that, let's just discuss a little bit about why at this stage of your life you have jowls. Well, a few years ago I wrote a book called The Fine Art of Looking Younger. And it was based on the idea that I wanted to first share with everyone who reads the book, and as I do it with my patients every day, and explaining that facial aging is two processes. One is volume loss, that is bone, muscle, fat, skin, soft tissue. Things get smaller, there's less volume. You look at a younger person, there's a lot more fullness in their face. Then there is descent and sagging. Now this is what you're probably manifesting now with the jowls. Now the sagging is two levels when you look at what is obvious. When the face sags, there is the descent of the skin, and then there's the descent of the underlying support structure called the SMAS. The SMAS is commonly referred to as the muscle, and it stands for superficial musculoaponeurotic system. And it is an extension of a muscle called the platysma muscle. So when you have jowls that typically represent sagging and an area of fat that is below your jawline, which diminishes the nice shape of the jawline. Now, a typical patient 15, 20 years ago would have accepted and realized that in order to solve this issue, some type of facelifting or face and neck lifting procedure needs to be undertaken. Then a proliferation of laser devices and heating devices came around to, from my perspective, essentially misrepresent that the effects of those devices can be the same as surgical procedures. In the 90s, there was a lot of excitement about the CO2 laser, and the CO2 laser was going to make facelifts obsolete. And then in the past decade or so, there have been several equipment manufacturers that essentially, through combination of selective language and, let's say, creative photography, make it appear that their results are equivalent to surgical procedures. In my practice, practically every day, we see people who have had some type of thermal device and have basically had less money because they spent a lot of money on doing this procedure, and two, not seeing the result. And in addition, it's been my observation that these newer thermal devices actually heat up the skin so aggressively that it's actually reducing the quality of the skin. There is a very important layer of fat under the skin that's very important for a youthful appearance. The concept of heating up the skin to tighten the skin to the point that it contracts and becomes tighter, unfortunately trades off trauma and damage to the blood supply and the fat. So as a surgeon, I see this, and I'm of course, I feel bad for the people who have bought into this, and it's not their fault. They actually see these things promoted on TV shows, and and it seems like great authorities are representing them as being significant. The principles always remain the same. if your face is sagging and you have jowls, you have different options on different kinds of surgical procedures which can be minimally invasive, limited, or more extensive face and neck lifting procedures. For some people, having a bit of a jowl can just require a little bit of liposculpture and maybe a little bit of neck tightening. That would probably be the least aggressive procedure. And for most people, anybody with jowls, it's some type of face lifting or face and neck lifting procedure. So before you invest your money in doing a quote non-surgical solution for jowls, do your research and look at actual results. And you'll probably realize that avoiding surgery altogether is not necessarily a smart way to go. Now, I'm not saying that non-surgical options can't help improve the appearance of the jowls. For example, there are patients of mine who come in and plan on having their face or neck lift later in about 1 or 2 years, but in the short term they have important events coming up. So we can soften the appearance of the jowls by strategic placement of fillers, such as Radiesse. As I described, volume loss is a factor in facial aging, and so with the limited correction of those areas of volume loss, particularly along the jawline in an area called the mandibular notch and the mesolabial fold, you can soften that appearance of the roundness of the jowl and make the jawline look a little bit better. So I think at this point I would recommend you meet with cosmetic surgeons. And I say specifically surgeons because unlike non-surgeons, surgeons are able to do everything. So if they have devices as well as injectables, they can offer that as a way to help you along your path or be very definitive about the necessity of a surgical procedure. So meet with doctors, look at their results, think of the way these procedures are done. In our practice, we do all our face and neck lifting procedure with a quick recovery concept where we do everything under local anesthesia with light IV sedation. Our patients recover quickly. The hesitation that many people feel about pursuing face or neck lifting surgery has to do mostly with the anesthesia and the recovery time. Well, in the past 20 years, I've been able to develop a way to minimize that while still doing a proper face and neck lift. It's not about shortcut procedures. We learned in the mid-2000s how shortcut procedures don't get very good long-term results. So again, meet with cosmetic surgeons whoever you're comfortable with and feel like this is something that you have a realistic objective that you'll be able to accomplish, and move forward with the best solution. So I hope that was helpful. I wish you the best of luck, and thank you for your question.